system specifically for livestock and companion animal range in Malaysia. First, let me introduce myself. My name is Nur Ashkin, and I am a sales executive of Sedingit Embun Sendirian Berhad. I will be your host for the webinar today together with Dr. Susan Chen from Ginrich Biotechnology. So before we delve deep into our topic tonight, here's a reminder for our participants. Throughout our discussion here, should you find yourself curious or want to clarify any particular point, please feel free to drop your questions in the Q&A box. Your inquiries will be addressed during our interactive Q&A segment later. Now, it is my distinct pleasure to introduce our esteemed speaker for today here, Dr. Chang Lee Wang, right? Okay, he's here.
Yeah.
Hi, Dr. Wang Chang
Hi,
Lee. All right.
hello. Good evening, everyone. And today I want to share some of our experience of the PCR in Taiwan, because in Taiwan we already have more than 200 POCKIT Central PCR system already installed in the pet clinics, and our vets are already use PCR as their other instrument, just like CPC. They use that every day for almost every animal. So I want to share this experience to you, and that everybody know how the PCR can help us, because I'm also a vet in Taiwan. How the PCR can help us, because before, I think when I was a student in the vet school, we don't have PCR in clinic. We only have the PCR in the university, and it's very complicated and very expensive. So at that time, I asked my professor, I say, why should we learn this technique? We don't need the PCR, but I want to say, after COVID-19, everything was changed. For now, in Taiwan, maybe the elementary school student, they know, oh, PCR. Okay, I know what is PCR, because we have do the PCR of COVID-19 in maybe last year or in 2022. So everybody know PCR. And we also have the Pakistan now. It is a perfect system for the vet clinic. It can do a lot of things and do a lot of help for us. So let me introduce our system. And when we talk about, because we are talking about the feline disease, in the feline disease, there are two old disease, and they are also very severe disease. The name is FIV and FELV. I believe every vet know these two diseases a lot, but we have some uh, major problem in these two diseases, because this disease, they have long incubation period, and they don't have any significant clinical sign. So we cannot only take a look of this animal and say, okay, I know that is FIV, or oh, okay, that is FELV. It is almost impossible. But these two diseases will cause the immunosuppressive. That means sometimes those cats with these two diseases, the symptom not will be another disease, because they have the immunosuppressive. It makes other pathogen can infect them more easily. But in the end, they have the FIV or FELV. It will increase the difficult of our vets to do the right diagnosis. And their blood test result is also very common. They they have low WBC and low PLT. Some cats have anemia, some cats don't. So the CBC can give us a very small help. So it is very hard to diagnose only by clinical sign or by the blood test. And why these two diseases are so important? we can separate this question to the two parts, for the animal and for the owner. And another part is for our vets. For the animal and for the owner, these two diseases cannot be cured. But if you already infected these two viruses, uh, everybody will suggest you don't take your cat go outdoor, and it should be isolation and give them very good nutrition. Of course, castration, because you don't want to have many uh, kitties with FIV or FELV. And if you have this kind of cat, you should go to clinics when any kind of illness happen, because all kind of illness of the immunosuppression cats maybe become very serious disease. So these two diseases cannot be cured, but it doesn't mean the cat will dead immediately. So maybe we just know, okay, my cat already got FIV or FEOV, and if I can take care the cats in a very good condition, maybe it can still have very good life quality and also long life. That is why important for the owner and the animal. Why should we have the correct diagnosis earlier? And for the vets, okay, I believe everyone, most of you, we are all vets. We have to ask ourselves a question. What is the owners they really want when they face a disease cannot be cured? Yeah, of course, everyone wants their pets' health. Very happy, happiness, of course. But what when you told them, this disease cannot be cured, what they want to know another news, some maybe just like we saw a drama. The doctor say I have a good news and a bad news. Which one you want to hear first? Okay, we already have the bad news. Your cat was infected by a very severe and cannot be cured virus. And what is the good news to them? They need a solid answer, and they want to know what they can do. Both of these questions, the answer can only provide by the PCR, because just like I said, um, the PCR is the best tool for these two disease diagnosis. And so for some different situation, we can, I want to share with you the, in a different situation, how can we introduce the PCR to the owner, and what is the benefit of PCR for this situation. The first one is when people have new animal in Taiwan and in also in many other country, the owner will take the animal, the cat, to a vet clinic for health check. Of course, in traditional, the health check only means take a look and check the the furs or the other things, the lymph node, touch the lymph node, check everything and have the body temperature. Of course, they are health check, but I believe if we human, we go to a human hospital for health check, uh, we will do more and more tests than the physical check. So for the animals, they should have the same treatment. So for most of clinics in Taiwan, when they met the owner, have a new animal, maybe a kitty, they will ask, where you get this animal? From the breeder or from the shelter? And from the breeder, sometimes some very bad breeder, bad businessmen, they will put some, special price on certain animal. Why? Because they already know this cat have some serious disease, but the symptom is not very severe now. So if they buy a cat from the breeder with a special price, the vets will suggest them maybe you should do a PCR for these two viruses now, because if uh, the result is positive, maybe you should find the people who sold you this cat and make him give you your money back. Yeah. And from shelter, you have to do the check. It is not an optional choice. It is not. You have to do the check because in Taiwan and many countries, uh, people collect those stray animal to the shelter. You don't know what this animal uh their situation, their environment before they go into the shelter. So they have very high risk of FIV and FELV. So see, because you want to have a very happiness and very good time with this cat, so you have to do the check in everything, in the beginning of everything, and that will give you a very good time with your cat. But if you have a cat with these two virus, uh, maybe you have to pay a lot of money on the mm, medicine and take care for their health. So in the beginning, the vet will give them suggestion, do the PCR for health check to make sure this kitty was safe and clean. And sometimes they go to the vet clinic because they want to have the vaccination. Because in cat, we know we have lots of several, maybe 6 or 10 to 1 vaccination. We have lots of choice, and most of the people, the owner, especially after COVID-19, everyone know the vaccine is very important. So sometimes they will take their cat for the vaccination, but for the vaccination, there's one very serious problem is because these two viruses, they will induce some suppression, and these kind of things will reduce the ability of all vaccine. So it means if you don't do the PCR check for this virus and they pay for the vaccine, and then the cat still got the disease that vaccine should against. They will think, is my vet really give the vaccine to the animal, or the vet just take my money but give me maybe normal saline, not real vaccine? They will feel very angry and very crazy. And for now, I believe every owner, when they decide to uh, take the animal to which vet clinic, they will check the comment on the Google Map. So they will leave very bad comment on the Google Map, and that will uh, be a bad thing, very, very bad thing for your business. Actually, uh, of course, even other social media, maybe Instagram or Facebook, they will say, oh, which clinic, the doctor was very bad. I pay for the vaccine, but my animal still got this disease. But you you already give the animal real vaccine, but because the FIV and the FELV, so the cat cannot produce enough antibody to against maybe FHV or any kind of disease. So you you have done everything right, but they still think that is your fault. That is very bad. So if the cat, especially the kittens, they go, you have to inject the vaccine. The best way to protect us is do the PCR first. You have to make sure this cat has no other, no or no these two virus, and you can do the vaccination. And for the PCR, I know many people will think PCR sometimes in many countries they can send the blood sample to some lab, and maybe after 2 or 3 days or longer or sooner, they will give you the result. But that is also not very good for business because the owner, they have job. They have to make their time to take the animal to your clinic. I believe they want to uh, done everything in one visit to your clinic. So what is the best choice for us is use our Pocket Central because it only need 85 minutes and give you the result. And the sensitivity and specificity is the same with the real-time PCR. Actually, I can say the sensitivity and the specificity is the same with the COVID-19 real-time PCR in Taiwan because the Pocket Central, uh, in Taiwan, we are the first PCR system got the human COVID-19 real-time PCR test EUA, the certification of the human COVID-19. So our system, the performance is very good, even for the human uh, medicine or human diagnosis, human disease diagnosis. So if you got the negative result by the PCR, okay, do the vaccination just like always. And if you got the positive, you have to inform the owner and discuss about what should we do next. You still want the vaccination or not? It's decided by the owner. But I already told you what kind of disease this cat already have, not caused by me. Yeah, so that will avoid lots of the risk of uh, the angry customers. So another thing is we want to reduce the risk. In the in the other hand, we also want to raise the profit. In Taiwan, when the vets they do the vaccination, they will earn 30 US dollars. Yeah, it's good. I'm not sure how about this in Malaysia, but we can earn 30 US dollar. It's good. But if you do the PCR for the FIV and FELV, can reduce your risk and it can earn 60 US dollar profit. It's very good because if you don't have the PCR, you can only earn 30 US dollar. But if you have PCR, you can earn 30 plus 60 US dollar. It is the 90 US dollar. It increase your profit to 3 times. So I believe every vet, including me, I want to earn more money. And another thing is for the internal medicine, I think maybe more than 80% cases is for the internal medicine. And for the pregnancy cat, Of course, we can do all the tests we have to do for the pregnancy animal, but don't forget, we can also do the PCR to check and predict the state of the kittens because no owner want to, if we can have new kittens, we are very happy, but no one want to have a cat with disease. If we cannot avoid this, at least that we know the situation earlier. And for the other infectious disease, the FIV and FELV positive cats, they are immunocompromised. And it will cause some problem. It will cause longer course of treatment and worse prognosis. So that's why we should check and let the owners know before begin our therapy to avoid the medical dispute. Why? Let me do some explain. Sometimes the I I can say almost every time the owner will ask you a question: how long my cat will be cured? How long? And if you told them 2 weeks, of course, when the 2 weeks comes, okay, the cat already healthy, of course everybody happy. But if the cat already have these two virus, I think the course time of treatment should be longer. So maybe in the 3 weeks and 4 weeks, the cat still doesn't feel very good. And the owner will think, I think my vet is not very good because he said 2 weeks will be cured, but for now already 1 month. Yeah, this is also not very good for our business. So do the PCR before you begin the treatment. It can also uh, make sure your judgment was right. And it can also give a good image for your customer, the pet owner. They will think, oh, my vet are very professional. They have PCR, but other clinics, maybe they don't have PCR. So I believe I made the good choice because this clinic is better. They have PCR, and the PCR was the same with humans disease PCR. And the third part is about the surgical. Sometimes maybe the animal they will come for, maybe they just hit by a car or they just come here for the castration or different kind of surgery. And we should do the pre-operative examination because for human, if we have any surgery, I believe our human hospital will ask us to do lots of tests or lots of examination. But when I was a student in the vet school, we don't have this kind of pre-operative examination. But for now, we can do this because we, I believe we all know the surgery will cause a huge stress to the animal. And if this animal, they don't have very good immunity, that will be very dangerous because uh, they will have high risk for the secondary infection, especially for the cats which have these two virus. They need more special care to avoid the infection. And if they have these two disease, of course, the surgery can you can still do this surgery, but after the surgery, they should be isolated from other animal to avoid the infection. And for the FELV, they have very high chance to contaminate your environment and your equipment. So if you have this kind of cat, af after the surgery, you should do very good disinfection to all the environment and equipment. And I know many people they want to know. I think we already have some rapid test in the vet market. Yes, yes, many different kind provider they have rapid test. And for now, I believe everyone know the rapid test because of COVID-19. But uh, we can just watch this article, this table. Um, in in all kind of rapid test, we can find. Okay, let me show you. Okay, we can find they are all the rapid tests are serology test, right? Because they are testing the antigen and antibody, so they are serology. And PCR we test about the nucleotide. In this research, we can find in these 20 cats, if we use PCR for test to test the virus, we can find maybe I think 9 or 10 positive in these 20 cats, but only one cat have the positive result in serology result. So it means if you only use the rapid test, I have to say I love rapid test. I use a lot of rapid test. I think it is a useful tool. But in these two viruses, if you only use rapid test, maybe you will miss a lot of positive case. And I think that is not good for the diagnosis. So when next time, maybe the customer said, you already use rapid test, and why you still want me pay for the PCR? And we can explain to them for COVID-19, when you have the positive in the rapid test and the hospital will ask you to do the PCR for check, right? Yes, that's why I use the rapid test, and then I also want you pay for the PCR test because that will be a better diagnosis tool. Yeah, wait. And when we talk about PCR, of course, many lab, many instrument, they will say they can do very good PCR. Of course, I believe them. But for our POCKIT Central, our IIPCR, we already have a published article. It can prove we have very good performance in these two virus detection. Yeah, maybe other provider or other label, maybe they have, maybe they don't have, but we have. So you can believe in our result from our IIPCR. Yeah, so the conclusion, after my introduction about which kind of situation you can find almost every situation. If there is one cat come to your hospital, and test the, you should ask the owner do the PCR test for FIV and FELV. And what is the benefit to us? Because one test, the profit to us is in Taiwan is 30 US dollar. Two tests means 60 US dollar. So it means one cat you can earn more 60 US dollar by FIV and FELV PCR. If you only test 3 cats a day for these two viruses, you can earn 5,000 and 400 US dollar per month. I think it is very good profit for everyone. So if you have POCKIT Central in your clinic, it is not just like an usual instrument. It is like an ATM machine to your hospital. Yeah, and after the FIV and FELV, in the beginning, I just want to introduce these two, FIV and FELV. But for now, I have to introduce the FIP for everyone because these diseases have some change already over the world. I believe everybody already know FIP a lot, and its pathogen was feline coronavirus, the FCOV. And for regular feline coronavirus, it can only cause some, slight diarrhea. But if the virus have mutant in the cat body, it sometimes it will become to FIP, and that is very serious disease. Before 2019, the mortality is almost 100%. So before 2019, many vets they will think I don't have to do the diagnosis because if I have the very good diagnosis, I know that cat has FIP, but I cannot save them. So the diagnosis is not necessary. But for now, also after COVID-19, we have a lot of antivirus drug, especially the coronavirus drug, because COVID-19 and FIP, they are both caused by coronavirus. And for in many research, the vets all over the world, they already prove the GS441524. They have very, very good result in the FIP cats. If you just do some search on the PubMed, you can find there are a lot of articles are talking about how good is that drug for the FIP. But uh, when I do this slide, they are still illegal all over the world in the veterinary use. But for now, in lots of parts such as UK and Australia and Japan, more and more country they permit this drug for veterinary use. So I believe one day in Malaysia, your government will open the access of this very good virus for the FIP treatment. And so we know the FCOV, they are usually harmless and only cause slightly illness, but sometimes they will become FIP. And the major people think the scholars, they think the major cause of the mutation was considered about the cat genes. And an important issue is over 70% FIP cats was pedigree cats because they don't have many polymorphic genome. And it is also, this disease was also found after World War II because after World War II, people, they have peacetime, they will want to spend more money to buy pedigree cats. So that disease happened. And one of the best specialists is Dr. Patterson. He suggests don't let FIP cats mating again. So you have to do the castration if those cats survive after the FIP. And so for the PCR detection of FIP, if we found a cat, they just come for a regular health check, they don't have FIP symptoms, we can test the rectal swab. And for the cats already have some FIP symptom, we can test the fluid of abdomen or chest and also the rectal swab. And the importance of detection is we want to build up the the FCOV free herd. Breeders, they don't want to their kittens have FCOV because maybe one day it will turn to FIP. So if you are a breeder, you have to do this for the healthy cats, use the rectal swab. And two, for the cats already have FIP symptoms, you will want to do the diagnosis earlier. And if you can use the antivirus drug, the prognosis also will be better. And sometimes, if you do the PCR of FCOV, you can have a very good benefit is for the breeders, you can get rid of the FIP high risk cats. And we talk a lot about the PCR for FIP. So let's just take a look of the guideline of FIP. Okay, you can find, I collect some information from this guideline, the 2022 AFP guideline. And they suggest us if the history and presenting sign are consistent with FIP and the FCOV, not FIP, remember? The FCOV RNA is detected in fluid or tissue using PCR. Then there is a high chance that cat has FIP. So next time when you met any cat, you doubt that maybe look like FIP, don't forget, use the PCR for the confirmed result. And maybe if you can get the antivirus drug, and you can begin to use that drug. So there's still no vaccine for that disease, and many different kind of the anti-COVID-19 drug, they have very good result in against FIP. I joined a Congress in Japan last week. There are lots of vets. We are talking about the treatment of FIP. For now, that is become a normal disease, not a super lethal disease. So I think this news also give us some information is early diagnosis, early detection is become more important for the treatment of FIP. Yeah, so that is my presentation today. Yeah, and in the end, I also want to introduce something about what our POCKIT Central can do. Yeah, so remember, POCKIT Central is not a PCR machine. It is a PCR lab inside your clinic. And you don't have to hire any, technician with master degree or PhD degree. Everyone can operate the POCKIT Central correctly because it is very, very simple. It's even more simple than maybe your microscope or your CBC machine in your clinic. So don't think the PCR was a difficult and complicated system. It is very easy and fast and correct. Yeah, thank you for your listening. Yeah, okay, Ms. Shikin, it's your turn.
Okay, a tremendous thank you to Dr. Chang Li Wang for such an insightful and informative presentation. Your expertise has shed invaluable light on the power of PCR in assisting pet clinics with feline disease management. Okay, so now to our participants, I encourage each of you to post any remaining question you may have in your mind right now. Is there any question? Okay. All right, okay, there's one question. What is the minimum and maximum number of sample that can be tested in one run using POCKIT Central? Because I think we as a laboratory technician, okay, CMO is actually a diagnostic lab in Dengkil. So usually our real-time PCR or normal thermocycler, we have to run quite a very big large volume of sample in one run. If all the reagent will be wasted. But how about POCKIT Central? Dr. Wang Li, can you explain to our participants?
Yes, for POCKIT Central, we have some special design. You can run 1 to 8 different sample at the same time because all of our reagents we are separate. So if you want to test only one sample, you just put one set of reagents into the machine. If you want to test 8, you just put 8 sample. And this kind of design give you a very good choice because you can run the test immediately. You don't have to wait because my former work was in a lab. Every time, every day, we waiting for more sample until the
Yes.
sample number reach maybe 96, and I run the PCR at the same time. But sometimes maybe I have to wait 2 or 3 days to reach the 96 reaction. So you don't have to worry about this because all the this consumables and the reagents are separate one by one. Yeah, and if there is a rush, you have many different cats or dogs come into your clinics at the same time. Of course, you can run 8 at the same time, but if only one, you just run that. That the price was the same. Yeah, you will not waste any money on only run one PCR in one time. Yeah.
Great, amazing. So it's very suit with the companion animal actually because the sample volume that they can offer, Centric can offer is actually very tailored to the sample volume for hospital or clinics because not every clinic will have the large volume of sample like what laboratory are accepting. Okay. All right. Okay. Is there any other question? All right. Can it detect dog's disease? What kind of disease?
Yeah, of course it can test dog disease. Actually, we have, I think, maybe more than 20 dog disease. We already have the uh, pre-designed kit, and it include lots of common disease like Alicia, Anaplasma, babesiosis, and canine distemper, lots of disease. And I believe in future we can give you some list of our kit, and you can check the disease that you are interested about is on the list or not. And if not, you can give us maybe an email, and our R&D team we will try to create the detection kit for that disease as soon as possible. Don't worry, every year we have new disease detection kit launch. Yeah.
Thank you so much. Yes, they are very proactive in developing imaging disease, and every year there's a lot of new kits that we can offer to our customers, and we also buy them for our customer. So another question is, what kind of sample we need to collect for PCR?
I think that is depend on the what kind of disease or what kind of pathogen that you want to detect. Some of them are for blood, some of them are maybe some fluid or the rectal swab or oral swab. That is decided by the different disease, but don't worry. Every time when you order the detection kit, we will have our user manual. On the user manual, the menu will tell you what kind of the sample is the best choice of this pathogen detection.
Okay. So next question, can we run the different disease reagent at the same time?
Yeah, of course. Just like I mentioned, you can run 1 to 8 reactions at the same time. So sometimes if you just cannot think, oh, which kind of disease I want to test, maybe you can just put one sample and test 8 different kind of pathogen at the same time. Yeah, so it is up to 8.
Yeah. Okay, got another question. Okay, does you know about RHAM technology? What is the difference between RHAM and IIPCR?
What you mean the name before you said before the IPCR? Excuse me.
RHAM.
RHEM.
RHAM.
Okay.
So, do you know anything about this technology?
RHEM. So what is the complete name of this technology?
Yeah, I'm also not sure about it. I will ask the one who are asking right now. Okay, got no answer from him. So maybe we can skip this question. Is there a later I will come back again to this question after we get the answer. Okay, so is there any next question? No? All right, so we are almost end to our webinar. So before we part ways, I'm excited actually to share our news of our latest campaign tailored for companion animal clinics. Sedangkan One is offering an exclusive campaign for PCR diagnostic designed to empower companion animal clinics in their pursuit of accurate and efficient disease detection. So I will share with you our campaign right here. Okay. Can you all see the video, the campaign?
Yeah.
All right. Okay. So I think as we come to an end of our webinar, I want to extend a sincere thank you to each of you for joining us tonight. Your participation has made this session truly engaging and enriching. So don't miss out our opportunity to elevate your clinic capabilities. Thank you once again for being part of tonight's webinar. Thank you so much, Dr. Wang Cheng Li and Jean Rich also. Let's stay connected, continue learning, and make a difference in the world of veterinary care. Thank you so much, everyone.
Thank you.